Hello everyone, in this video we will learn how safety is assessed in pharmacovigilance based on three criteria. What are these three criteria? The first is that seriousness. So seriousness is that, as we have learned in the previous video, that adverse events, anything big small which is happening in clinical trial is known as events, right? If it is serious, if it is death, life threatening, birth defects, hospitalization, anything out of that, it means that it is serious, right? And if it is not, it's a minor, right? It is not impacting day-to-day activities, it will turn as an adverse event. Now the person met with an accident, right? If it is a minor, that it will event. If it is serious, that led to hospitalization, right, it will be turned to seriousness. Now the second criteria is the criteria 2 is that you can say casualty. Casualty is cause plus effect. So you have to establish a relationship between what has caused this effect, basically what has caused this adverse reaction, because participant is in a clinical trial. So you have to determine the relationship with the medicinal product. If this serious adverse event, this accident, when the medical monitor analyzed or when investigator analyzed, they found that there is a possibility that because of this medicinal product, person's ability to think clearly has been impacted or vision has been blurred. So that just a suspicion, that means it may be because of medicinal product. If we are saying that this is because of medicinal product, then it will turn to a reaction. The important is reaction. Even if it is say minor accident, person just fell off, right? Not a major, but still it is determined that it might be because of that, the person's ability to think clearly has been impacted or something has happened with him or her, then also it will turn as a reaction. But this will be known as adverse drug reaction. So it is not serious. But in both cases it is related to your medicinal product. So that is, you assess the casualty, cause and effect. Cause is medicinal product, effect accident has happened. This is mostly done by two people. One is investigator give their opinion, second is on a sponsor side medical monitor add their inputs. Now the third criteria is expectedness. Expectedness is that in a clinical trial we already having investigator brochure or information is there, SMPC, right, summary of medicinal product characteristics, right? If it is already mentioned that in that particular investigator brochure based on preclinical trials and based on previous clinical trial, then it will be considered expected. But if it is not mentioned in these two documents, it is unexpected, right? So when this is unexpected, then it will turn to suspected unexpected adverse reaction, which is your SUSAR. So you can also read a detailed guideline, efficacy guideline from pharmacovigilance, E2A to E2E guideline. I will also leave a link of these guidelines in the description so that you can refer on. But my suggestion will be download these, keep on referring. These guidelines not only help you at the time of an interview, but also during your job also. So now for SUSAR is that suspected unexpected adverse reaction. Important is reaction. There are three criteria to be yes, seriousness, yes, casualty, causal relationship marked as yes, related. Third is expectedness is yes. So when all these turn to yes, so 3 yes, then it is known as a suspected unexpected adverse reaction. I hope this video has helped you to understand how safety is assessed in pharmacovigilance, right? It may have cleared you a lot of doubts. So in case you want us to make a specific video, please leave a suggestion in a comment section. Thank you so much.
Thanks for watching. Turn on the notifications and do subscribe Rise and Shine channel for getting such valuable contents.